Hello, everyone, and welcome to this special online session by the Arab Hospital magazine. It's a pleasure to have you all with us, and I'm very happy to be joined by Dr. Miriana Hijaz, a leading gynecologist, oncologist at Henry Ford Medical Group. Dr. Hijaz has dedicated her career to caring for women with ovarian, cervical, uterine, and other gynecologic cancers, and continues to play a major role in advancing treatments and awareness in this field. Today, we'll be discussing some of the latest developments in gynecologic oncology, the importance of early diagnosis, and how innovations in care are helping improve outcomes for patients. So hello, doctor, welcome.
Hi, Miriana, thanks for having me.
So doctor, my first question, many people confuse the gynecologic cancers. Can you explain? Because two of them are very important to women and they hear about them all the time. Can you explain the difference between ovarian and cervical cancer?
Of course. So gynecological cancer is a general term. It's a general umbrella that carries underneath it different types of cancers. And those types depend on what is the organ of origin. So ovarian cancer corresponds to cancers that arise from the ovaries, and we generally put under them as well ovaries and fallopian tubes, and the peritoneum, which is that lining inside the abdomen. Cervical cancer is different because it arises from the cervix, although all are considered gynecological organs, but they have their differences in terms of which exact organ of origin it is.
So, and why is it so important to raise awareness about ovarian and cervical cancers in particular, I mean?
Absolutely, because we are getting to a point where prevention is becoming more and more important in cancers. Specifically for cervical cancer, one of its main characteristics is that most cervical cancers can be preventable, which is why this type of awareness is extremely important for women and young girls as well, in order to get checked and get early detection.
So let's start tackling the cervical cancer first, so with our question. So you said you talked about the difference between the two cancers. What role do pap smears and the HPV testing play in prevention and early detection in cervical cancer?
It plays an absolute significant role, a great role, because most of the cervical cancers are actually related to the HPV infection. And so, like I said, prevention is one of the most important things to do when it comes to cervical cancer. And prevention can happen through awareness, and it also can happen through routine checkups, including pap smears and HPV testing. So we have specific guidelines with regards to when to start testing and how to test. But doing pap smears regularly and according to the guidelines plays a significant role in catching not just cervical cancer, but those very early, even precancerous cells or precancerous stages that could be immediately tackled and cured to prevent anything else from getting worse.
Okay. So at what age should a girl or a woman start? For example, for pap smears or HPV, we're going to talk about the vaccine also. So
yes. So most of the guidelines start their screening at age 21. But we have some patients who have higher risk factors, so they could be tested a little bit earlier. But most guidelines say 21 age and above.
Okay. So even though, for example, for the HPV vaccine, we know that it reduces the cervical cancer cases in the world, and we have like evidence and everything. So at what age should a girl do this? And how do advise parents to because some parents, they are against vaccines, we know that. So what is your opinion on this?
So we have had multiple studies and research that led us to the conclusion that HPV vaccine can be protective. The guidelines currently mention starting HPV vaccination even at age 9. And here in the United States, it's approved up until age 45 years of age. That wasn't the case a few years ago. It was approved from 9 to the mid-20s. but right now they have extended its use to up to 45 years of age because it has been found to be protective, especially for those high-risk HPV strains that are directly associated with the development of cervical cancer. And most of the studies that we have seen have shown that in women or young girls who have not yet been exposed to the HPV virus, getting the HPV vaccine seems to be the most protective.
Okay, but you are saying that even if a woman is sexually active, she can do the vaccine till the age of 45.
Correct. These are the current guidelines here.
Okay, great. So, and what symptoms should a woman never ignore when it comes to cervical health?
One thing is bleeding that's out of the norm. So anything like a bleeding or spotting, any feelness of any that she notices, anything that's kind of out of the ordinary. But the most common thing that we see is abnormal spotting or bleeding that's out of the norm or out of the ordinary.
And what do you say to, for example, women in perimenopause or premenopausal women? They have, like, the symptoms for hormonal changes. They have spottings between cycles, and so this could be a false alarm, or what do they have to do in this case?
Those symptoms can be vague. And not every woman who has bleeding or spotting out of the ordinary means she has cancer, right? So there are many factors that could be completely benign that lead to those types of symptoms. But it's the importance of regular checkups. Being up to date with your healthcare maintenance is of utmost importance because you can establish a baseline of what's normal for your body, and a good relationship between you and your doctor or physician that knows you over the years, who can do these exams and essentially kind of tell the difference if there are any at the time of the examination, as well as actually getting checked for her routine well-woman checkups, and health maintenance is extremely important as well.
And who is considered a high risk for cervical cancer?
The cervical cancer risk factors are slightly different than the other risk factors for ovarian or other types of gynecological cancer. But for cervix, mainly, like I said, it's mainly driven by an HPV infection. So most of those cases are HPV related. And so things like very early sexual activity or having a high-risk sexual partners or multiple partners that might have the HPV infection. Patients who smoke are twice as likely to get cervical cancer than patients who do not smoke. Having a weak immune system, which decreases the body's ability to fight HPV and therefore lead to HPV being chronic. It's a chronic infection. There are other minor risk factors. Long-term use of birth control pills over years and years, for example, has been coded to be one of the risk factors. And there are certain types of exposures, like old medicine that used to be given to pregnant patients in the past. It's called DES. So it's a type of synthetic estrogen. Those women who are exposed to it, their daughters are at increased risk for developing certain types of cervix cancer. So those are the major risk factors for cervix cancer.
Okay, so, and doctor, if someone has HPV, for example, what are the things a woman should do to for prevention, or she cannot, or take something, a medicine, or to prevent having cervical cancers?
The most important thing to know, Mirna, is that most HPV infections are actually cleared by the body. If a woman has an active HPV infection, there are things that she can do in terms of follow-up. There's testing that she can do to ensure that that HPV infection did not translate into changes in the cells that would be precancerous. There's no, so far, specific medicine that would target HPV and clear it completely.
Yeah.
There have been some studies with regards to some supplements or vitamins that could help the immune system fight it. But the most important thing is follow-up and making sure the proper testing is done.
Now let's go to the ovarian cancer questions. So we know that ovarian cancer is often called the silent killer because detection is very hard to detect ovarian cancers. So what are the early warning signs that women should pay attention to? We know that it's always diagnosed at a late stage, and it's a very aggressive kind of cancer. So, what can you tell us? What can we look for to avoid this late stage in cancer?
You're absolutely right, Myrna. For ovarian cancer, yes, it is called the silent killer because a lot of its symptoms tend to be vague.
Yeah.
Some symptoms include things like abdominal pain, but everybody has abdominal pain every now and then, right? So you're really talking about a pain that doesn't necessarily go away. It's there, it's dull, it's present for a long period of time. Any type of, you notice an increased fullness, you actually notice something growing in the pelvis. Some women have other symptoms, again, like abnormal bleeding or a sudden weight loss that is not intended, right? A major change in their appetite. Again, these tend to be vague, but you know your body better than anybody. And so I always tell my patients, if you notice something that has become consistent different in your symptoms, get checked. And it's also important to know one's own risk factors. So if you have a family history of ovarian cancer, that's important because that raises your awareness about any major changes in your symptoms, for example.
So are there any new tests now in the market that can tell us if there's ovarian cancer? For example, we do like mammograms and so for the breast cancer, do we have new tests in the market or no?
So there are new tests, Mirna, but so far a lot of them are not standard of care for testing randomly for ovarian cancer unless you have specific risk factors. And those of the main risk factors that we're talking about are mainly genetic, right? So if somebody is carrying a mutation that would put them at an increased risk for developing ovarian cancer, those are the type of patients that we actually have protocols for testing them. So there's blood tests that can be done. There's imaging that can be done, like ultrasounds or CAT scans, to look for any changes, any cysts, any masses that pop up, or any abnormalities in the blood work.
So you were talking about history, family history, or mutations are the main factors or main risks for ovarian cancer. Is there any other factors we can talk about for ovarian cancer?
There are other risk factors for ovarian cancer, putting family history and genetics aside, which are one of the major ones. Older age by itself is unfortunately a factor for developing ovarian cancer. As you said, most of the patients that develop ovarian cancer are in their older age. Never being pregnant, we call it nulliparity, and certain type of pathologies like endometriosis, for example, can put a woman at a slightly increased risk for developing specific types of ovarian.
So now we hear about hormonal replacement therapies. There's a controversy about these hormones. We don't know if we should take them, we should not, if there's a higher risk with taking them or no, especially for ovarian cancer. I mean, we know for breast cancer, there's some regulations, but for ovarian cancer also. Because I heard sometimes it's a positive thing to take hormonal replacement therapy for ovarian cancer.
So the topic of hormone replacement therapy is so huge, and you're absolutely right that there are a lot of controversies related to it. What we can summarize it in is, one, does the person have a personal history of cancer, and what type, and is it hormone receptive? Because there are cancer types that have receptors that could be fed, as we say, by the estrogen, and some cancers that are not necessarily related, where women can actually benefit from being given hormone replacement therapy. And that goes back to the particular risk factors for even a good conversation to be had between the patient and her oncologist or her physician about what those risk factors are and whether it's beneficial to be given hormone replacement therapy. You're absolutely right. There's a lot of back and forth with it. But there are women who would really benefit from hormone replacement therapy on many aspects of their life that are not necessarily associated with an increased risk of developing cancers. So we have to bring it back to the particular risk factors and the conversation with her physician.
So, doctor, and how is ovarian cancer usually diagnosed?
So it is usually diagnosed through a combination of blood work and imaging. That's the most common way of diagnosing it. And usually the woman presents with symptoms, and either an ultrasound or a CAT scan is done that would detect an abnormality in the pelvis or in the abdomen.
Can we talk about a little bit about the treatment options we have now? Because we know what are the latest advancement in treatments for ovarian cancer?
The treatment depends on the age of the patient, the functional status, as well as the stage of the cancer. But the cornerstone of ovarian cancer treatment is a combination of surgery with systemic therapy. And that systemic therapy can be chemotherapy in the form of chemotherapy, but right now we also have a lot of advances in the treatments of ovarian cancer and a lot of more options right now that we did not have 10, 15 years ago with regards to treatment of ovarian cancer. So a lot of the treatment right now is being personalized to the type of cancer and the type of even mutations that the cancer is carrying. So we can target them more specifically and hopefully with less side effects on the patient.
So we said that usually it's detected at a late stage, the ovarian cancer. What is the survival rate for? We know that the survival rate is a bit low for ovarian cancer. So, is there any new advancements in this, in treatments? I mean.
Absolutely. So the survival that you talk about 10, 15, 20 years ago is different from the survival that we are currently seeing, because more and more patients are actually surviving ovarian cancer, despite the fact that it's diagnosed at a later stage, because we have more options for treatment. And we also have more options right now for something called maintenance therapy, which means even at the end of their primary treatment for ovarian cancer, there are certain medications that we can put the patient on to keep the cancer repressed and prevent it from coming back. So we are seeing more and more patients on those maintenance therapies, and they're living longer and longer after treatment for ovarian.
So we didn't talk about cervical cancer treatments. Can we tackle that, please?
Of course. So again, same as any other cancer, with cervical cancer, the treatment will depend on the stage. The number one thing that I keep insisting on and keep reminding all my patients is that, cervical cancer can be preventable. But once cervical cancer develops, in the very early stages, it can be treated with surgery alone. The more advanced it is, the more other treatment modalities have to be included, whether it is radiation or chemotherapy or immunotherapy or more of the targeted agents, depending on the stage and whether this is a primary or a recurrent setting.
So, Doctor, what message of hope and empowerment would you like to share with women and families going through these kind of cancers?
Cancer diagnosis can be very scary, and it can be a big bad news to the patient and their families. But what I always stress is that prevention is important, but also knowledge is important, because now we have way more options for treatment than what we had years ago. And I know that a lot of patients get scared of the side effects of treatment itself. And a lot of patients run away from being treated because they are scared of the side effects of things like chemotherapy or radiation. With the technological advances that we have right now, we are getting better quality of life and less side effects, which is why knowledge is important. A good discussion with the oncologist is important as well, because right now more options are available to our patients, and they can be way more tolerated than what we used to hearing before.
How do you approach your patients at Henry Ford Medical Group? I mean, how do you have like a support, psychological support? Do you talk to the families? How do you, if someone is diagnosed with cancer?
Absolutely. So at Henry Ford, we have a multidisciplinary team.
Yeah.
So that multidisciplinary team has obviously the physician, the oncologist taking care of the patient. But we also have a big team that's treating the entire patient and their support system and their families. So those types of support are available to the patient, even to the things like physical therapy and acupuncture and things like that that would help the patient go through the treatments, tolerate them better, and have a better quality of life.
And do you think community awareness and if the community work with the healthcare organizations, they can help much more in raising awareness and encourage prevention?
Absolutely. Absolutely. Again, we go back to awareness and prevention being the main aspects of improving overall survival for cancers like that. So it is really, unfortunately, the patients who either don't have enough access or don't have the appropriate access that tend to suffer the from these cancers and tend to be diagnosed at the later stage. So completely agree with you. So diagnosis, awareness, prevention, and a really good collaboration between the hospitals, the physicians, and our community workers to raise that awareness in the community is of significant importance.
So your last message to the girls out there, I mean the young girls, a message of prevention, I mean.
Know your body, know your symptoms, know your risk factors, and get tested and get the HPV vaccine because it can prevent a lot of just precancers as well as cancerous lesions happening.
Great. Thank you, Doctor, for your time. It was a great interview and very good information. And hopefully we'll have another one soon.
Thank you, Miriana. I appreciate you having me today.